Hello everyone. This video is going to be a walkthrough of some sample problems that use Z codes. The PowerPoint is going to be a lot less detailed than you're probably used to, but that's just because I'm going to be spending a lot more time in the manual. So hopefully that's something that works for you all. If not, let me know in the discussion and we can adjust things for the next video. But this is just really going to build off some of the information from the other video that I posted from 2021 and hopefully exemplify a few of the things that we are talking about in our textbook as well. Okay, so here is the first problem. Patient presents for HIV screening. Patient is asymptomatic. If you've not taken medical terminology yet, or you're in the process of taking it, asymptomatic means they do not currently have symptoms. They don't have anything that would suggest they have HIV. So they're just there for a general screening. This could be because they're engaged in some kind of high-risk behavior, they had some kind of exposure, or they have another reason to believe that HIV screening is appropriate, or it could be a part of a general wellness check. We don't have any information about that at this point. All we know, they're there for the screening and they do not have any symptoms that would lead a physician to believe they already have HIV. So these are the two guidelines that are really going to help us code this effectively. There are others as well, but this one is going to be these two are going to be particularly helpful for us. Guideline 1C1A1, don't worry, we will look at it, states code only confirmed cases of HIV. So code B20 is the code for HIV, and that is the code you're going to append to all cases of confirmed HIV. However, this guideline is telling us we would never use that code unless we are confirmed that the patient actually has HIV. It doesn't mean that the doctor believes they probably have HIV, we're trying to rule out HIV, or even that we are screening for HIV. They have to have some statement in their chart, their progress note, what have you, by the clinician that states the patient is positive or has an HIV-related illness, has a condition that is only a result of having HIV. So those are the two conditions that would allow us to use the code B20, which is HIV. And then guideline 1C1A2H, again, we'll look at it, don't worry, states that if a patient is being seen to determine his or her HIV status, use code Z11.4. And so this is giving us some guidance on what would be the appropriate code for screening. So let's go ahead and look at the manual itself. If you would like to pause right now and see if you can find the code yourself, that'd be great. And then you can resume and follow along with me. All right, so here we are with our 2022 manual. And we're going to go to the guidelines to code this scenario. And here's the scenario we're looking at. HIV screening, asymptomatic. Normally, no, you're not going to go to the guidelines every time. However, when it comes to HIV, I think it is helpful to be very, very certain about the exact scenario that you are coding. HIV has a lot of stipulations in the manual. So if you are coding a lot of HIV related cases, you will need to be very familiar with the guidelines. And I just want to make sure we're emphasizing that we always want to make sure we're coding from the guidelines. We are following the guidelines for everything we do. Okay, so on page 10, if you're using this manual, we get to, remember we're in section 1, this is letter C. This is when we get into the chapter specific coding guidelines. So the other guidelines in here were specifically, we're actually not specifically, we're very general guidelines. And they apply to the use of the entire manual. And when we get into chapter specific, you guessed it, they are codes specifically related to a chapter within the manual. So what is a chapter? It specifies in here what codes apply to what chapter. So for chapter 1, it says certain infectious and parasitic diseases, and it specifies it's A00 to B99. So that when we get in the tabular, remember we've tabbed A and B. And if you're using Bucks, it'll tell you here on the sides, chapter 1. And if not, it'll tell you at the top of the chapter, chapter 1, and which codes apply to that chapter. And usually it's going to be 1 letter, 2 letters. Occasionally, there will be a letter that codes apply to multiple different chapters, but don't worry, we'll get into those. But for this circumstance, infectious diseases, chapter 1 is all of A and B. Okay, so any code starts with A or B is going to be related to chapter 1. Now you'll notice in here, we also have a couple of codes from the letter U. Why is that? That's because we have added COVID. So COVID codes are now involved in chapter 1. And we do have specific guidelines for those. We're not looking at them right now, but that is covered in chapter 1 because that is an infectious disease. So right now, chapter 1 has mainly HIV and sepsis. Those are going to be the 2 big guideline subjects that you're going to see in here. There are other ones in here. And like I said, we do talk about COVID as well. And there's extensive guidelines about coding that. But HIV and sepsis are really big in chapter 1. And so there's several different letters and numbers in here that are just related to coding HIV and HIV related conditions. And so it's very important that you are able to quickly reference this portion of the guidelines and know exactly how to code that scenario, because there's a lot of different things. Like if we're talking about inconclusive diagnoses, pregnancy, there's specific rules for coding all of those kinds of situations. So it's just really good to be able to reference this. For this specific circumstance, we are looking at A1, remember 1C, 1A, and 1. Code only confirmed cases. So that's what I had written in the PowerPoint, and that's stating, and as I said here, B20, that's what a confirmed case is. But this is stating that you should only use that code if you have the doctor's statement, the provider's statement, that the patient is HIV positive or has an HIV related condition. You do not have to have a blood test taken every time or other kind of lab work to confirm HIV status, but you do have to have that physician statement. The other guideline I'm going to direct you to is letter H. It's over here on the other page. And this states if a patient is being seen to determine his or her HIV status, use code Z11.4 and counter for screening for HIV. Use an additional code for any associated high-risk behavior if applicable. So we can't assume any high-risk behavior. We have to have documentation of that and it has to be applicable to the situation. If a patient with signs or symptoms is being seen for HIV, code the signs and symptoms. And as I stated, we do not have any signs or symptoms. Patient doesn't have any symptoms right now. It also advises you how to code counseling for HIV, if that has been provided, and what to do when the test gets back. We don't have any information about that right now. All we know is we've done the HIV screening and there are no signs or symptoms. So we're going to look at Z11.4. So we're going to use that as our guidance right now. But first, yes, we're going to do it from the alpha. So this directed us to encounter for screening for human immunodeficiency virus. So if we're taking that literally, a good way to find this code would be go to encounter screening HIV. So those would be the terms that we're going to look for, okay? I'm going to show you, this is going to send us straight to screening, but that's okay. I want to show you anyway, because I would guess if you are new to this, it would make most sense to you to start with encounter. And yes, that's a great way to start. So we come to encounter and then it says screening here. There are no subterms listed. It just says C screening. Okay. I don't know if you guys can see that. It's a little bright in here. So C screening. So we are now going to go to screening. Okay, so if you look at screening, and in my manual, it's on 421. Screening's up here at the top. Well, it starts at the bottom here, but up here at the top is where most of it is. And then it goes to disease. So you want to screen for a disease. That makes sense. And under there, as a subterm, is HIV. If you all can see this. Hold on. Here we go. So we had screening at the top, then disease, then as a subterm, HIV. So, and that is sending us to that same code, Z11.4. But I also wanted to show you that did not make sense. Could also do screening. Again, at the top, it's the same category, screening, sexually transmitted disease, and then a subterm there was HIV as well. And that sends you to the same place, Z11.4. Okay, so now we're going to check that out in our tabular. Yes, we always check it. If we stop now, that would be coding from the alpha, which is the a mortal sin in coding. So don't do it. But we have already coded or tabbed our Z codes. And we are looking at Z11.4. And if you're using the box, it will come right under this little green section. And if you ever see a little block like this in your manual that is showing you a section of the guidelines, the same guidelines we were looking at the front, but a section that is applicable to the codes underneath it. So this is a really great thing to be able to review quickly. If you see one of these, check it out. It is very helpful. A couple things. So this is talking about what a screening code is. And so that's really useful. I would read through it if I were you. And so here's our code here at the bottom, Z11.4, encounter for screening for HIV. We don't have any red stop sign. There's a red stop sign there. The excludes one is not applicable to us because this is for a diagnostic examination. We're not doing a diagnostic examination. We're doing a screening. And then this excludes two note applies to Z11.3. I don't know if you guys have seen that before, but sometimes there'll be an excludes note in a more specific code rather than right here at the top. But if that is the case, it's only applying to that code under which if it's directly underneath it, okay? So it's not going to apply to the Z11.4. So there's no additional guidance here. So we're going to go ahead and use Z11.4. Let's go back to our PowerPoint and double check. Alrighty, so we got it correct. And hopefully that's what you got. And if not, that's okay. Make a note of this in your manual. This would be a great time. Pause the video, make a note. And then in your table of contents, in fact, let's just do it right now. Let's go back to document camera and let's make a note of it. Okay. So here's our table of contents here. I haven't done much else, but I'm going to go find an empty page. And I know there's a bunch of pages at the back, so maybe I'll just use those. Okay. And I'm going to use this blank page. It's right after 1596, so I'm going to call it 1597. And I'm going to say disease-specific codes. I'll say coding scenarios. Okay. So HIV, that's a very specific disease. Use Z11.4 for screening. Do not use B20 unless confirmed HIV. Okay, so hopefully you guys can read that. I don't have the best handwriting. So that's all I'm going to put about that right now, because that's what I think I've distilled from this coding scenario. And that's all I'm going to have. And then I will put that at the front. So 1597. And I will put disease specific coding scenarios. And I might even put in here HIV. And then if I also end up making notes about maybe sepsis, COVID, something like that, I have left myself a little bit of space here. So that's how I do it, if you guys are wondering about how I do my notes. And I've seen a lot of questions about how to do notes. So I think that's a great note to have in there for you. Okay, let's go back. And sorry, I know that was a little bit of a non sequitur. It's not exactly related to Z codes, but let's hit everything while we're at it, you know? Okay. So the next scenario we're looking at is patient is admitted for chemotherapy for primary liver cancer. So chemotherapy is obviously a treatment for the liver cancer. All right, and we will get more into neoplasms or encoding cancer, but this is just kind of an introduction to it. So the guidelines that are most important here, there's a lot that are going to be important, but these are the two that I pulled as most applicable, is guideline 1C2E2, and this states if a patient admission or encounter is solely for the administration of chemotherapy, and I do ... because the guideline has some additional conditions in there. Assign code Z51.11, encounter for anti-neoplastic chemotherapy. Now, understanding this will require us to understand what anti-neoplastic means. So neoplasm means new growth. And anti-neoplastic is going to be against a new growth. So anything that is trying to take away a new growth. And then chemotherapy is, as we stated, the treatment for cancer. So at least in this circumstance, as the first listed or principal diagnosis. So if a patient admission is only for chemotherapy, that's the main purpose of it, you should list the first listed diagnosis as Z51.11. The malignancy, so the growth or the cancer for which the therapy is being provided, should be assigned as a secondary diagnosis. So this is helping us with sequencing. This is helping us know Z51.11 is for anti-neoplastic chemotherapy, so chemotherapy that's for a cancer, and then a second code should be assigned for the cancer itself. And then guideline 1C21B16, boy, that's a mouthful, states the following Z codes and categories may only be reported as first listed diagnosis. And Z51.1, encounter for anti-neoplastic chemotherapy and immunotherapy, is listed as one of those codes that can only be assigned as a first listed diagnosis. So this is helping us with the sequencing of these codes. So again, if we look at the scenario, the patient is admitted for chemotherapy. So we know we need to have something about chemotherapy, and the chemotherapy is for liver cancer. So we're going to have two codes. One will be the encounter for the chemotherapy, and one is going to be for the primary liver cancer. So we say primary because it's not from a secondary site. Again, we'll get into more of that as we go, but it's listed as primary. So we'll have primary liver cancer and chemotherapy. And we have learned from our guidelines how to sequence those two codes. So let's go ahead and go to the document camera and make this all make more sense. All right, we are back in our manual. We're going to go look at those two guidelines. Again, you do not have to check the guidelines specifically every single time you're using the manual, but I am just trying to enforce that everything we do in the manual is guided by the guidelines. That's what they are there for, okay? All right. And again, we are in that section 1, letter C, but now we are in chapter 2, which is neoplasms, and it's giving you the codes that apply to this chapter, C00 through code D49. Those are going to be neoplasms. And remember, neoplasm means new growth. So this isn't just cancer. There can be benign tumors or other growths that are not cancerous. But this chapter covers all of them. So that's what those codes are related to. And then we are looking specifically at letter E, which is, and number right here, admissions or encounters involving chemotherapy, immunotherapy, and radiation therapy. And these are the most common ways that we treat cancer or any kind of tumor or growth. These are the most common ways, is through chemotherapy, immunotherapy, or radiation. And then number 2 is patient admission or encounter solely for the administration of chemotherapy. That's what's applicable about this one. So we are doing an encounter that is just for chemotherapy for liver cancer. And it just states exactly what I had in the slide. If an encounter is for the administration of chemotherapy, and then here is that part that I skipped over. Encounter for the encounter for anti-neoplastic chemotherapy, Z51.11. So here we have encounter for chemotherapy, and then we'll have that primary liver cancer. So Z51. And that's going to be the first listed or principal diagnosis. And then at the top here, and it gives some additional clarification if they're getting more than one of those treatments. If they're getting, say, immunotherapy and chemotherapy, you can assign them in any order, but they would still, one or the other would be the first listed. But that doesn't apply to this situation, so we're not going to go over it right now. And then it says again here, the malignancy for which the therapy is being administered should be assigned as a secondary diagnosis. So this is the malignancy that we are treating with the chemotherapy. So that will be our second diagnosis. This will be our first, that will be our second. And then the next guideline is related to Z codes. And that is all the way at the end of the guidelines, or at the end of this section anyway. Because our Z codes are at the end of the book. So the chapter specific codes. So I wanted to see if I could find the beginning of this chapter for you. Okay. On my book, it's on page 40 in the guidelines. And this is factors influencing health status and or contact with health services. So this chapter is all about Z codes, and you can see it's Z00 through Z99. And it is a big section because there are a lot of different ways that we use Z codes, right? We can use them for contact or exposure. So if someone was exposed to a health hazard, we have Z codes for that. And there's a section here to talk about it. How do you use those? We have Z codes just for vaccinations. Z codes to describe the status of a patient. So if you have a genetic disposition to something, if you are a carrier of a specific disease, if you have a certain BMI, we have Z codes for that. If you have a history of something, so if you have a family history of a certain kind of cancer, that's in here. If you have a personal history of a certain kind of cancer or a certain disease, that is going to be in here as well. We have codes for observation. So if you're suspected to have a condition, we have a code for that. And we are observing you to see if you have it. If we have aftercare codes, then that's going to be mainly for if we are seeing a patient after a plastic surgery or reconstructive surgery, if you've just received like a prosthetic. So say you've lost, an arm and you've got a prosthetic arm and we're checking in on that. We've got Z codes for that. We have codes for counseling. If we're going to counsel you about your diet, we're going to counsel you about maybe using birth control or something like that. We've got codes for that. Then we have Z codes for reproductive services. So you can see all kinds of different things here. We mainly use this when we talk about the weeks of gestation, and we'll get more into that when we get into pregnancy itself, but we have Z codes that apply to that. We have miscellaneous codes. And then we have this section here, which is 16. So we are looking at B16 within this chapter. And that Z codes that may only be listed as the principal diagnosis. So these codes we can only use as a first listed diagnosis. And you'll notice that in here, Z51.1 is listed, and it has a little dash there stating, that other codes in that category would also be the first listed. So anything that starts with Z51.1 is going to be a first listed diagnosis. Okay, so that's helping us with the sequence already. So these are the two codes, so we already know we're likely going to be using this one, but we're going to go ahead and code this scenario anyway. Okay, so with encounter for chemotherapy, again, we'll start at encounter. In our alpha, we always start in the alpha. And I'm actually going to contradict myself in a minute on that, but stick with me. It'll make sense. Okay, so we have encounter here, and then chemotherapy is up here. So encounter for chemotherapy for neoplasm, Z51.11. Okay, and again, neoplasm means new growth. That's the primary reason that we have chemotherapy. There are other reasons, but we are looking for this one, Z51.11. So let's go ahead and flip to our Z codes and double check. And of course, when you're actually doing it, it's not going to take you this long. It's just because I am going through every possible variation on what you could do and why we do it. All right, so Z51.1 is right here. And it looks like the excludes codes are for non-neoplastic conditions, so codes that are not related to a new growth. That would exclude this code. We are talking about a new growth. We're talking about a neoplasm, which would be liver cancer. Z51.11 is encounter for anti-neoplastic chemotherapy. And so we are going to use that. And then you will also see here at the top of this section, Z51 says code also condition requiring care. So why do we need it? It's for that primary liver cancer. So how are we going to find primary liver cancer? So this is where I'm going to contradict myself a little bit. So you can definitely start here in the alpha. And I would say when you start doing this, go ahead and just start in the alpha because it's going to direct you to the right place. But you will be able to save time the more comfortable you get with the manual. So we come to cancer, and you're going to see in here, liver is not listed in here, right? There are a couple other kinds of cancers, but you must think, well, there's way more cancers than this, right? So it says see neoplasm by site, malignant. Okay, so what you can do in here is then you can, I think you could come into the alpha and go to neoplasm, and then it's still going to end up directing you to this table of neoplasms. Okay, so we coded this already, or tabbed this already rather. And this is a chart that helps us find codes related specifically to new growths. And it gives us a variety of different body parts. So we're always looking by the site, the location of the growth. And then we look by primary, secondary, benign uncertain behavior, or in situ benign uncertain behavior, or unspecified behavior. And we'll get more into what all of that means. But right now we know we are looking at primary. So the way we use this is we are going to look for the affected body part, which is liver. And then we're going to look at primary. Okay. So just find liver in here, and it's listed alphabetically. And then my book is on 492. And see, it gives you a little bit of specificity here. So it says liver, and it says see also index to disease by histology. So it's giving you some guidance there. But underneath the subterm, it's indented just like it is in the alpha. It says primary. So we have primary liver cancer, and it's malignant primary. Cancer is always going to be malignant. And then that's sending us to C22.8. So we're going to look at C22.8. Okay. Now, if this is overwhelming to you, that's okay. This is all new, but the more you use this chart, the more it's going to make sense, I promise. But to start, just make sure you can find the affected body part, and then we'll get into primary, secondary, all of that. Okay. But right now we're going to look at C22.8. And remember, chapter 2, when we looked in the manual, was that codes C00 to D49. These are all about new growths. These are all about tumors and cancers and anything that's growing that we don't want growing, right? So we're looking at C22.8. And we're looking at malignant neoplasm of liver. Malignant means cancerous. And C22.8, malignant, see if you can see this. Malignant neoplasm of liver, primary, unspecified as to type. Do we know the type? No, we don't. We just know primary liver cancer. C22.8, and then we're going to look at all the rest. Use additional code to identify alcohol abuse or hepatitis. We don't know anything about that. The excludes notes do not apply. And this excludes note is related to C22.1. So that is not related to us. So we have no other guidance here that is telling us we can't use this or we need to add an additional code or anything like that because we don't know anything about alcohol abuse or hepatitis. So we're just going to use C22.8. Okay. And we know the sequence here is going to be this is first, this is second, because the guidelines told us so. All right. We don't need any other reason besides the guidelines said to do that. All right. So let's go back to the PowerPoint and see if we got that correct. All right, Z51.11, C22.8. So we found it and we have it in the right order and the guidelines got us there, okay? So if the Neoplasm table is stressing you out, let me know in the discussion and I can do more in depth with that. I did want to kind of show you how to use it in an actual problem, but the focus of this was obviously on using the Z codes. But in the future, you're going to know if you see a malignancy, a tumor, a growth, something like that, we're always going to use that Neoplasm table. So we just got to get comfortable with it. I promise the more you use it, the more it's going to make sense. So if you have questions about these issues, the scenarios that we just went over, please post them. No question is too silly or simple or too out there. As long as it's focused on what we're learning, it's worth posting, okay? So let me know what you think, and I appreciate your patience with all this. Thank you. Bye-bye.